Turn it on. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Do you want the other ones too? 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. Microphone right there.
No, it's, I don't think so. So that's suddenly gotten much worse.
Yeah.
I think it's that much, because everything was fine.
Everything was fine till that mic got there. Yeah.
Yeah, I mean, I don't know otherwise.
Hmm.
Yeah.
Yeah. I'm thinking it. So
Can you tap that? Is that coming out here? That shouldn't be coming out of here.
you can probably hear it.
Okay, good. I just want to make sure something's not screwed up with the wireless.
Okay. Do we have 2 o'clock about? Okay. Everybody rolling? I think we're good. Okay. I just wanted to start by welcoming everybody here and thanking you for being here. My name is Lauren Zakalik. I'm the PR director of Henry Ford Health. I'd like to first introduce the 3 physicians who are joined us today and will be sharing their stories of their heroic care that they and their team provided on Sunday. Sitting directly to my right is Dr. Alan Jansen, ALAN JANSSEN. Dr. Jansen's title is Emergency Medicine Residency Program Director and the Medical Director of Emergency Medicine. To his right is Dr. Chris Ash. He is the normal spelling for both Chris and Ash, Medical Director of Surgical Services and a General and Trauma Surgeon. And then on the farthest right, so your left, is Dr. Sanford Ross, SANFORD ROSS. And he's an attending emergency physician and the assistant director of emergency medicine department at, they're all at Henry Ford Genesis Hospital, GENESYS. Thank you so much again for being here today. So we're here to talk about, like I mentioned, our brave medical team, how they handled the care and the stress of Sunday. We're going to start with the physicians telling us a little bit about that day, how it started. Then we'll open it up to questions. I will be calling on you so you can raise your hand rather than just yelling the questions out at our doctors. That would be preferable. We're only going to be addressing the tragedy from Sunday. Any other topics we're not going to address today. So I appreciate that. Let's go ahead and get started. So Dr. Jansen, if you could just set the stage for us, please, and tell us where you were Sunday when you learned and how you learned of the tragedy of the church.
Absolutely. So Dr. Ross and I were both working in the emergency department on Sunday morning. It was a bright sunny day and a Sunday morning, and the combination of those 2 things usually mean that your volumes are pretty low to start the day off. So we didn't have a lot of patients in the department, but at one point we did receive a phone call through the ER itself. And it was from one of my residents. My resident was actually in the church. And the resident said, there's an active shooter in our church. And that was before EMS had been called. That it was before anybody else knew about this. So initially, we just started to prepare the emergency department. I made 2 phone calls, Dr. Ross and I. One was to surgery, Dr. Ash, to kind of give him a heads up that it looks like we're going to get busy. And the other was to anesthesia so that they could start preparing the operating rooms. And then we waited for what seemed like a long time. But probably, I don't know, maybe 15, 20 minutes, ambulances started to arrive, people started to come through the door, and that's what started our day.
You want to take it from there, Dr. Ash? When you got that call from Dr. Jansen, what did you do?
When Dr. Jansen called, I guess I asked him, you know, how serious this was, because this type of stuff doesn't happen in Grand Blanc, Michigan. And so it sounded really serious and legit. And I got up and came into the hospital. And as I walked into the emergency room, all these patients just started rolling through the door, one after the other, with wounds that you just never see in Grand Blanc, Michigan. And so people trying to die and bleeding and little kids. So it was really all hands on deck. The teams did an amazing job helping us prioritize the care and deliver the care, to do our best to keep everybody alive, I guess.
Mhm, mhm.
That's probably the truth of that. So our teams were amazing as far as that goes. And we, you know, the work became kind of automatic and all for one and all on board at the same time.
So I think it's really important for those of you that may not be as familiar with emergency medicine. I think it's really important to understand that emergency medicine is a team sport. You need the entire team to be engaged. Everybody has to be on the same page. And I'm not talking about the emergency department. I'm talking about everyone from EMS to the fire department, to your police, to your registration, to all your techs in the department and your nurses. And we had some outstanding nurses that day, especially. It's just the entire thing, the entire group has to work as one to be successful. And I couldn't be prouder of our community and our hospital in making that happen that day.
You bring up a great point too. We want to thank the city of Grand Blanc for having us here. Of course, they've been wonderful partners throughout this whole thing. Dr. Ross, where did you come into play? Were you working that day already?
I was in the department with Dr. Jansen. We were notified that we would be receiving casualties. The first casualty was a pediatric whose mom walked him through the front door and was directed right to the trauma bay where he received treatment. It was a orthopedic injury. We notified orthopedics who were in the department. And what I'm most impressed with is the teamwork. The collaboration between all the services was outstanding, and it was just like you would imagine, everyone lending a hand and doing the appropriate things.
We can open it up to questions now that we've sort of set the stage. Go ahead, Steve Carmody.
Have any of you had experience with a mass casualty event like this, or if any of you had military service and saw similar ones?
We have had more auto, not shootings, but we have had multiple victims from auto accidents or other type of accidents all at once. I think the difference here was, first of all, some of our residents were involved in this. So we had a personal interest in that. We knew some of the patients coming in, which always makes it more difficult when you can put a name with a face and that you know them. And also the type of injury that we were receiving were upfront more serious than typical.
So I have had some experience. I've not been in the military. I do have a relationship with law enforcement and actually function on a local SWAT team as the medical director. And so I have been involved in some mass shootings in the past.
Yes, Tim.
So you want to go ahead and finish that question?
Okay.
No, I don't have any military experience. I did do my trauma training as a resident 25 years ago out in Los Angeles and Compton. So I guess that could be military training in a way. You know, a place is kind of a war zone back in the 90s, but nothing formal, and no mass casualty experiences. I guess I'll say that, thankfully.
Tim?
Yeah, Dr. Ash, you said something which explains that people trying to die. Explain what you're talking about.
Well, I think that anybody that comes in after having a gunshot wound the gunshot wounds can be lethal. We all know that. And, people coming in with low blood pressures or no blood pressures, your goal is to try to not let the gunshot kill them. I mean, I think that's the honest to God truth. And people try to die when they're shot often. That's part of what doing trauma surgery is about. You save their lives, if that makes sense. I don't know if that answers your question, but that's.
It gets into the, it does. Right.
One of the other things that Dr. Ross brought up was about how we kind of had a personal connection to this shooting. We had, at least 5+ of our residents and their families go to this church every Sunday. They're very devout parishioners, and their kids were there and their wives were there, and some of them were physically there. And so it was, some of them acted with heroics to bring and pull people out of the fire and then share that story with us when they came in for their own treatment. So this is deeply personal to our community, not just our hospital or giving care. At least I'm from this community. I live 25+ years here, and I practice here for that time frame. So these are our people, and so especially when we train these residents, we spend a lot of time with them, and they're part of our extended family. And to see them go through this and their families go through this is just heartbreaking. And I've told a lot of people, words cannot describe the feeling. We really shouldn't have to go through this in any community.
Kristen?
Were
And then I'll
any
take
of
Charles.
any of the residents' families or themselves injured in the attack?
Yes, one of our residents' child was.
As well as 2 of our other residents.
Charlie Langton?
Just give us an idea, this happened around 10:30 or so Sunday morning. You guys got there, how long did it take you before you left the hospital?
I didn't leave until about 10 o'clock p.m. For all kinds of reasons. One, we had several operations to do on several of the patients, and the follow-up, spending time talking with their families, which is kind of a very interesting experience because they're in an equally weird kind of shock that you don't normally get from a family member. We've all had sick family members at some point in our lives. You're in shock a little because your family member's sick, but you didn't personally just go through this traumatic experience. But every one of the family members I talked to were at church. Their kids were at church. And so it was a unique experience, I think, for all of us in that way.
Also, the 2 gunshot wounds at the hospital, 3 from smoke inhalation.
We had five gunshot wounds at the hospital and 3 smoke inhalations.
Some of them, we had 3 gunshot wounds that were critical patients, and several, like the young boy that Sandy talked about, were, I guess, no gunshots, benign, but were smaller injuries, and he got to go home later that day. So
Darren Cunningham?
You all see a lot as it is, but to have this personal connection and this mass casualty, how do you all?
I think our training helps us cope through this. And a daily basis, we see some horrific either illness or traumas, and you adjust. I think what really turned us was not only the age and the severity of the injuries, but also the connection. We were treating our own, which is always a little harder. We always are invested in any of the patients that come in, but when you spend day after day with that person and then they come in as a trauma, or their family does, I think it hits you just a little different.
Go ahead.
Thank you. Adrian Bronis from NBC News Network. First, I'm going to ask a question, and then after you answer, I'm just wondering if you could share with all of us something you would want us to know that we necessarily ask or even know to ask. And so my question is, you all said earlier in the week that when this patient cared for was 6 years old, what are those conversations like? When you're treating someone that young, what do you do to help them get through the worst day of their life?
Well, I hate to say you try to normalize it, but you do try to, you try to level set with that individual. You talk on their level as best you can. You show them kindness and caring and that they're safe. The biggest thing people worry about is safety and am I going to be okay? And that's what people need to hear. And it doesn't really matter whether you're 6 or whether you're 80. It's just the way that you say it, I think.
You know, I think you get down to kind of the humanizing nature of medicine, and I guess I would hope society to a certain extent. Talk to the little kid, tell him he's going to be okay. You know, share some love and compassion with him. Get his mom to come and hold his hand. Those type of things, I think, help the 6-year-old do okay. But even with the people that were sicker, you know, it is being there and just having just natural compassion for them and love for them, which, to be honest, I think is probably something we all need to do in the world in reflection on this experience. You know, none of us should really have to go through this. The world can't be tolerant and care about disagreements and not have to hurt each other, at least in my opinion. And I would hope that most of us have that opinion, I think. So.
What stands out about the 6-year-old to me, I took care of him, was he didn't shed one tear. He walked in the emergency department stoic. Mom was a wreck, which as a parent, I completely understand. And what I did was I looked at the wound, had an idea of what was going on, and comforted both, I think, them by telling him and Mom, you're going to get through this. You'll be okay. But I'm just amazed. I know there was shock in the patient, but there was not one tear, which is a strong kid.
Go ahead.
I was just wondering if each of you guys had any moment, you know, knowing that it was a couple days ago now, but is there a moment that you think back to that sort of tells a story of the teamwork that you spoke about earlier that you can remember that day?
I think the challenging thing in these kinds of situations is the unknown. So we didn't know how many people we were going to get. We didn't know what kind of conditions they were in. But I think that one of the things that went really well was we took care of the most critical first, and then we immediately started to reposition patients to other areas and get rooms, the trauma bays, cleaned back up and ready for the next patient that may or may not come in. And I think that, you know, that involved quite a few people, because to turn over a room like that quickly, to move the patient to the next best room where you could still watch them because they were semi-stable, but if they became unstable, you could still get to them quickly. That's a lot of, that takes a lot of teamwork and leadership and thought process to make sure that you're optimizing the care for what may or may not come in.
One of the other things that I found was once the process started and we started to take care of the people with our small group, recruitment happened very fast. We had surgeons calling. Dr. Paulson came in, one of the vascular surgeons here in town. 3 heart surgeons came in from the Detroit area to help us out. Dr. Vance, our trauma director, came in to help us out, and he was super helpful with the care we delivered. There were several of our residents that are Mormon that didn't go to church that day and had just had a baby. And he came in from home to help both take care of his brothers as well as help us deliver care and him deliver care. And so there were people that their family, you know, were lucky to be alive. And they still came in and did their part to be of service. And so, and that just wasn't our Mormon residents. That was a bunch of our residents. People gave up their Sundays, came in out of nowhere. So it was the immediate teamwork was amazing. We worked well together. You know, we delegated, we trusted, all of those things that you want as part of a functioning team. But you also had the people that came in and went above and beyond to deliver the great care we delivered on Sunday.
Dr. Ross, you want to add to any of the teamwork comments?
No, I think it.
Okay, great.
Thank you. Could we have a status update on people who were treated at your hospital? What conditions are they in? How many remain hospitalized?
3 remain hospitalized. I think it's fair to say that 2 are in fair condition and 1 is improving, is a much improving status. No,
The rest have all been released from the hospital.
correct.
So 10 admitted, 7,
8 admitted, and we have 3 left in our care, and all 3 are in improving, not in critical condition. They're in fair condition. Yeah.
On Sunday, at one point, I heard the police chief say something to the effect of one patient had passed away here at the hospital. Is that true? And what can you tell us about what happened in that moment and what that did to morale too while you're working on this whole group of patients?
Yes, we did have a patient who passed away from a gunshot wound. It was an extraordinary team effort by far. Just we did everything we could, and the injuries were too great. Morale, I think you have to say, like a soldier in a battle, you have to compartmentalize and move on. We anticipated other injuries coming in. We had to prepare for that. And afterwards is when you decompress and think about it.
I think being the trauma surgeon on call and all of us hoping that everyone lives, it's hard. I think it's really hard to have somebody that is traumatically injured or for any reason die. I think unfortunately we probably have a sense that we're supposed to be able to save everybody, but we can't. And that was probably the reflection difficult thing for me. You know, you feel bad and almost sorry that you couldn't, even though you did your best, that you couldn't keep them alive or save them or keep them from dying. Back to my comment earlier. I went yesterday to the vigil that they had at the hospital, and they had these crosses out in front. And, you know, you write your sayings on them. And I felt a really strong urge just to say I was sorry. As weird as that sounds, because I guess I am. I feel bad that we didn't have the miracle to be able to save him. And I think that's part of the struggle people in medicine have, is that we can't save everybody, but I think the world kind of expects us that we should be able to. And that's the hard part of doing this job, especially in this situation, because we can only do what people's bodies allow us to do, I guess. That answers your question. So
Yeah, just to follow really quickly. How many children, how many adults?
we only had 1 child and all the rest were adults.
Darren?
I know that will train for that academy. Based on this real life experience, what are the most important recommendations you give other healthcare providers, hospitals preparing for mass casualty shooting?
We actually just had a mass casualty training a month or 2 prior. What I would tell other facilities is it can and probably will happen to you. I never thought it would happen to us. Our company, we took care of a lot of the patients, not us personally, but our partners in Las Vegas after that horrendous shooting. And a few other places, I think we've had mass casualties. And, you know, you always say it could happen, but it probably will happen, which is the unfortunate thing.
I think that's probably the biggest thing, is that all of us thinking that this isn't going to happen here. You know, I think that's one of the things that happen. People get a little complacent and get a little, you know, grandiose, that we're not going to have a mass shooting in Grand Blanc, Michigan. Well, we're wrong. It can happen anywhere. You know, we're all equally at risk, which is, I guess, I would hope people would start to change their minds about each other a little bit and start having a little more grace and tolerance.
We'll go to Charlie and then Adrian. Charlie?
You're from here. What's been the reaction that you get, or what did you learn about the community here from this mass shooting?
I personally received a lot of texts and phone calls, and even in my community where I live, just people asking how I'm doing and just giving their condolences that this happened. And it's just an outreach of sympathy and thank yous.
And I think that we've also seen a lot of support from the community, but also from our hospitals and physician groups to provide counseling and support. A lot of resources along those lines, because people are affected differently, and they're affected differently based on the timeline. You know, you may not feel like you need some support for a couple days or a week, but knowing that those resources are there and that the community is out there supporting it is, I think, really very reassuring.
Adrian?
And just for clarity, I want to make sure our language is correct. All three are in fair condition and improving? Okay. Thank you.
Or we'll take just one or two more questions if anybody else has
Yeah,
any.
just a quick
Okay,
follow-up
Tim.
with Dr. Ash, maybe. You're talking about the physical wounds healing. Can you just go into the emotional wounds and how this is going to live with us for us?
Are you talking about the patients or the care teams?
Society.
Well, the physical wounds will heal, and some of them will be problematic for the patients for their lives to a certain extent. For the little kids that got ushered out the exit door because they were shielded from a gunshot from a friend, I don't know if those wounds will heal. You know, our resident whose kids were at church with his wife while he was operating with me that night at the hospital, his kids will probably never be the same. You know, they're sadly going to have an emotional thing they're going to have to work with for life. They're young. And so I think us as a society need to kind of maybe wake up a little bit and realize that we don't need to do these type of things. And we really need to have these type of experiences inspire people to love more and hate a lot less. There's really nothing to hate, honestly. We're not all that much different. And for a disagreement or two or a belief system, there's really no justification for anybody to have to die for any reason because you don't like my sandbox that I play in. You think about it in that simple terms, that's how silly it is. But here, these type of things happen because we hate. And unfortunately, it happens in the news and happens just in the corner store and at the bar sometimes with people. We don't need to hate anymore. And that would be my message to everybody. Stop. There's no reason for it.
Thank you. Last question, anybody? Okay, Steve?
Obviously, there's a labor situation
Oh.
going on at the hospital. Did that in any way affect your ability to respond to this emergency?
No, we're not able to speak about any, that's not the time or the place. Thank you. Okay, everybody, thank you so much. We appreciate you. Again, thank you so much to the city of Grand Blanc for lending us your space, and we appreciate you during this time. Thank you. And then we'll have the doctors leave first, and then everybody else can